Hi everybody, I'm Meredith Baker for On the Map Off the Radar, and I'm here with Smitha Mallaiah, who's a mind-body intervention specialist at the Integrative Medicine Center at MD Anderson Cancer Center. And some of you might enjoy yoga, but you might not actually know that there are medical benefits to yoga. A quote that I heard this weekend at a Yoga for Health conference, which Smitha ran, was, "Medicine works on the body and yoga and meditation work on the soul." But at the MD Anderson Integrative Medicine Center, they're finding a way to bridge the two. And so Smitha is going to talk to us a little bit about the research that's going on here and the programs for patients undergoing cancer treatment with yoga. So thank you so much for taking the time.
Sure, excited to be here, Meredith.
And could you just briefly give us an overview about how yoga is being used for cancer patients here at MD Anderson?
Sure. So as we know, as we understand, yoga is an ancient science, probably older than 5,000 years, and it's a beautiful science to connect the mind body of the individual, and this has been practiced and passed on since centuries, generations to us. And when these practices are done in a perfect synchronization of the mind body breath component, they yield some really good and amazing health benefits, and this is what we are really interested to study here at the MD Anderson. And because yoga has so many practices, and there is a huge range that you can pick and use with certain populations, it becomes really a very easy therapeutic tool that you can work actually on many different populations, including cancer patients.
Could you explain the intervention that's being done currently with cancer patients in regards to yoga here?
Sure. So MD Anderson actually has few research studies, more than one, that we're looking at different cancer populations to see how yoga can benefit them. And one of the most well-known yoga research study that you can say is one of the studies on our breast cancer patients that we're doing. And to note out there for all the yoga teachers and yoga therapists, this is one of the largest funded and largest running trial on any population in yoga in the world today. Wow. And it's happening at MD Anderson, so we are really excited to be part of it. And what we have seen from the previous yoga studies with cancer population, and actually with other populations also, is that yoga practices has this great innate ability to produce a relaxation response at your nervous system. So, and we know that stress is the biggest problem today, and so many psychosomatic or stress-related ailments that we have. So if you can conquer that relaxation mechanism or stress at the body level, we're hoping to see that there are many benefits like improvement in quality of life, which can include better physical functioning, better spiritual, emotional functioning, being able to do your daily routine activities in a better way. Two, things like better sleep quality. And actually there was a study in Bangalore, India, which looked at reduced radiotoxicity if people practiced yoga during radiation. Wow. So the really the areas that we're looking is wide and huge, depending upon populations that we study. We also have lung cancer trials, we have brain tumors trials, and different populations that we're going in to see.
So if a patient opts in for the yoga treatment, then what does that look like in terms of schedule? Like what kind of yoga interventions do you guys do with them?
What they go through basically. So there are two things. One, they could actually opt into a research program, which basically we screen for their eligibility and record them into the program, and they go through a specific number of classes, like 18 classes during their radiation or 15 classes during their chemotherapy, depending upon whatever the protocol is for. And they come into typically a one-on-one setting where they meet with a trained yoga professional instructor to get whatever is prescribed in the protocol for that specific population. We also have a clinic side of the integrative medicine where patients can come in. They don't have to be in any study, but they can come in to say, I want to learn some meditation because I'm having really high anxiety going through this cancer treatment. So they could meet with a meditation expert in here and meet, depending upon their schedule, meet so many times in a given week and take classes from an expert at the Integrative Medicine Center here at MD Anderson.
So it sounds like it's really bridging this approach between not just the medicine or the chemotherapy and things like this, but saying that these go hand in hand and are complementary to techniques that you gain from doing yoga or practicing meditation.
Absolutely, and actually, funny you bring up the complementary part of it. So every tradition around the world, or every culture and nation around the world, has what we call as their own traditional form of medicines. And it used to be, or not too long ago, people used to call it alternative complementary medicines, where you either do this or that. But at MD Anderson, what is really different is it is integrative. So where you actually bring in these different wonderful therapies to the patient while they're going through treatment. And to mention, we do this with actually the help of integrative oncologists. So basically, modern medical doctors who are trained in this integrative therapies, who can help patients make the right choices and safe choices while they're going through their cancer treatment.
And for the patients and their families, has the yoga program been widely received?
Accepted? Yes, that's a very good question. Many times we do have this notion of cancer patients are tired, you want to take it easy, don't exercise, don't do yoga, or I don't know if I should do yoga, different things, and people come with different notions. But surprisingly, and not so surprisingly, our consent rates to many of our research studies are really high. If you go recruit out there saying, we have a yoga study, would you like to participate? People are more than willing to do. And I think I can quote that we have consent rates over 70% or so for most of our studies.
That's remarkable.
Yes, and even for our Integrative Medicine Center, our classes are full, and we try to look at larger spaces to accommodate more families and people. So it's very, very welcomed and well received from the patients and families.
That's amazing. What an amazing opportunity to be able to offer something like that to cancer patients and their families. And then as a final question, I wanted to know, what have the research findings been of this study so far, and what are the future steps in the study, and also in plans of disseminating the results that the study brings about?
Great. So for this specific study that we talked about, the breast cancer, we are still under recruitment. So unlike pharmacological studies where you can actually start looking at the results, we don't get to look at the results until we finish the last patient. But as I mentioned earlier, some of the real areas that we are interested is their sleep, their quality of life, and their stress hormone or stress regulation, basically, because there is a lot of research out there, and even here at our MD Anderson labs, that stress can regulate tumor microbiome and the tumor growth and things like that.
So regulating your stress levels
can help,
huge.
Actually, yes. And one also other thing is, stress is not something that is necessarily looked at something you have to manage. There are people who give a lot of importance to exercising, diet, nutrition, but many times people don't think about really stress management. But stress management has been a very, very, very key component in studying, in general, cancer in large, as well as actually looking at inflammation pathways that can be activated if you have high stress levels. So stress is something that we're really looking at from the study also. Another very important thing that probably not many or any yoga studies have included is actually looking at the cost effectiveness of this and trying to see if we can convince any insurance companies or people, the big people that actually have to take these into our medical care, to see actually if this reduced any kind of health costs during the treatment if they practiced yoga.
And that would be huge.
That would be really huge, to see if we can say, here there are really some tangible numbers that you want to look at.
Get your yoga covered by your health insurance.
Health insurance, and probably you can all start doing yoga and insurance can cover for it. And we can even start looking at yoga therapy, benefits of yoga and meditation at a deeper level, and it doesn't have to be out of your pocket, and it doesn't have to pain anybody to do this, because that is one of the reasons people probably don't do yoga during disease distress, because it is another thing that is out of your pocket.
Right, and the very principles of yoga should make it open to everybody. Exactly. And then in terms of the dissemination of the results, are the people involved in the project hoping that other hospitals in other parts of the country will adopt similar mind-body approaches to medicine, or has that been done in other hospitals?
Again, surprisingly, but not so surprisingly, many of the cancer institutes across the country has mind-body sessions for their patients, but may not be so much research. So as we all know that research is a very important part of our medical system, that we want evidence-based, safe research practices, safe practices for our patients and families. So there are some research studies that are going around the country, and we do hope that this can actually inspire other institutes to take up to do research actually with many other populations that are needing these kind of services. And definitely we do think that this will be something that will inspire and become available for centers and patients around the country.
And hopefully yoga teachers can get involved in lending their services to people going through cancer treatment as well.
Absolutely, and that is actually one of the goals of integrative medicine. Is from our education department, we want to educate professionals out there who can actually help and become providers in the community to, it could be cancer patients or it could be any other patients, but actually where we can have more help for our own community so we can be all healthy and happy.
Right, exactly, and paying that good karma forward.
Yes, absolutely.
Well, Smitha, it's been an absolute pleasure. Thank you so much. This has been so interesting, and thank you guys for watching On the Map Off the Radar. Hopefully many of you will be off to a yoga class after this session. So thanks for watching. We'll include a link for the Integrative Medicine Center below if you'd like more information. Bye.
Bye. Namaste.
Namaste.